Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Understanding hernias. A simple explanation. A hernia happens when an internal part of your body pushes through a weak spot in the muscle or tissue that holds it in place. Imagine a bulge under your skin, often in the abdomen or groin area. That's what a hernia can look or feel like. Hernias can happen to anyone, but they're more common as we get older or if we strain our abdominal muscles. While some hernias might not cause noticeable symptoms, others can be painful or lead to complications if not addressed. The good news is that hernias are treatable, and understanding them is the first step. In this guide, we'll break down everything you need to know about hernias in simple terms. From the different types to the causes, symptoms, and treatment options, we'll equip you with the knowledge to take charge of your health. Hernias are categorized based on where they occur in the body. Let's look at the most common types. Inguinal hernia. This is the most common type, affecting the groin area. It happens when part of the intestine pushes through a weak spot in the abdominal wall. Umbilical hernia. As the name suggests, this type occurs around the belly button. It's common in babies but can also affect adults, especially those who are overweight or obese. Incisional hernia. This type develops after surgery in the abdomen. The incision creates a weak spot and internal organs might protrude through it. Hiatal hernia. Unlike other hernias that are external, this one occurs inside the body. It happens when part of the stomach pushes up into the chest cavity through an opening in the diaphragm. Each type of hernia has unique characteristics, but they all share the common feature of involving a protrusion of an internal part through a weakened area. Hernias often develop due to a combination of factors that weaken the abdominal wall or put excessive pressure on it. Some common causes include age. As we age, our muscles naturally weaken, making us more susceptible to hernias. Heavy lifting. Straining during heavy lifting or strenuous activities can put pressure on the abdominal wall, increasing the risk of developing a hernia. Pregnancy. The pressure of a growing fetus during pregnancy can weaken the abdominal muscles, making women more prone to hernias, especially umbilical hernias. Obesity. Excess weight puts added strain on the abdominal wall, making overweight or obese individuals more likely to develop hernias. Chronic cough. Persistent coughing, often associated with conditions like COPD, can increase pressure in the abdomen, contributing to hernia development. Constipation. Straining during bowel movements due to constipation can also weaken the abdominal wall over time. Section 4. Recognizing the signs, symptoms of a hernia. Hernias often present with noticeable symptoms, making it important to be aware of the signs and seek medical attention if you suspect you might have one. Common symptoms include a bulge or swelling under the skin, especially in the groin, abdomen, or belly button area. This bulge might be more prominent when standing or coughing. Pain or discomfort at the site of the hernia, which may worsen with activities like lifting, bending, or coughing. A feeling of pressure or fullness in the affected area. Nausea or vomiting, especially if a hernia becomes strangulated, cutting off blood supply to the protruding organ. Pain or burning sensation in the area of the hernia. It's crucial to remember that not all hernias cause pain. Some might only present as a painless bulge, but it's still essential to get it checked by a doctor to prevent potential complications. Surgery can be performed using traditional open surgery or minimally invasive techniques like laparoscopy. Laparoscopic surgery involves smaller incisions, leading to faster recovery times and less scarring. Your doctor will discuss the best surgical approach based on your individual needs. Section 6. Preventing hernias. Tips for a healthier you. While not all hernias are preventable, certain lifestyle modifications and precautions can significantly reduce your risk of developing one. Maintain a healthy weight. Losing weight, if you're overweight or obese, can reduce pressure on your abdominal wall, lowering the risk of hernias. Eat a high-fiber diet. This promotes regular bowel movements and prevents constipation, reducing strain on your abdominal muscles. Lift objects safely. When lifting heavy objects, use proper lifting techniques, engaging your legs and keeping your back straight to avoid putting excessive strain on your abdominal wall. Quit smoking. Smoking weakens muscles and increases your risk of developing various health issues, including hernias. Seek treatment for chronic cough. If you have a persistent cough, consult your doctor to address the underlying cause and reduce strain on your abdominal muscles. By incorporating these preventive measures into your life, you can significantly reduce your chances of developing a hernia and enjoy better overall health. UMCC, your ultimate medical consultants connectors.